Alright, so next thing we're going to test is a lumbar PA joint glide. First thing I have to do is make sure that her lumbar spine is in neutral. If she's sitting in too much extension here, then I'm going to use a pillow under her stomach to bring her up into neutral so that we can test joint play in a neutral position. So Megan, can I place this pillow right under your stomach for me, please? I've doubled it over and come on back down. And we're going to look again to make sure that she looks good. This is a little bit low, it's under her hips, so I'm gonna move it up a little bit more maybe. There you go. All right, so now I'm looking from the side and I can see that her lumbar spine is now in neutral and she's not propped up too much on her hips. All right, for this test, the first thing we have to do is identify L5. All right, so to do that, I'm going to palpate for the PSIs, and then I'm gonna find her sacrum here. Okay, so that should be right between. So with one hand, I'm going to press down on her sacrum, and palpating with the other hand, I need to find the first segment that doesn't move with the sacrum, so the first lumbar vertebrae. So I'm pushing anteriorly, and I can feel my thumb moving with the sacrum. And here I can feel that the caudal segment is moving, so S1, but the cranial segment is staying put, so that would be L5, not moving with the sacrum. Okay. Once I've identified L5, which is right here, I'm then going to create a PA glide by taking my foot hand, placing it right over the spinous process of L5, reinforcing it with my other hand, and then giving a posterior to anterior glide down and up, assessing for the amount of movement and also asking for irritability potentially. Next, I'm going to palpate for L4 and repeat that at L4. Down and let it rebound. I'm going to then move up to L3, repeating it at each segment. Okay, how does that feel, Megan? Is that painful at all when I do that?
A little bit.
Is it? Okay. So that was L3. Repeat at L2. How's that one feel?
That's better.
That's better. And then L1. How about that one?
Not painful.
No pain at all. All right, so I've now assessed for mobility and irritability at those segments, and I can go back and use a similar technique to treat a stiff segment. Okay, so if I identified that L3 or L2 was hypomobile, I could come back down there, making sure I palpate back to the segment of interest, and now I could use the same position for a treatment with more force and more sustained hold. Is that okay, Megan?